Keys to success number 88, Dr. Martin Rutherford, certified functional medicine practitioner, chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
So these are keys to success, and these keys to success cover a wide variety of topics. I was discussing with a patient yesterday, this is a lifestyle change, like way beyond the lifestyle change of I've decided to go on a diet. And today we're going to talk about the fact that you have to have some ability to have some sort of a resource or understand on your own how to kind of sift through the BS that's out there that has the potential to sabotage what you're doing. I'm specifically talking about a British medical journal article that came out this week on the potential cardiac implications of gluten-free diets, in which now they didn't conclude this in there. They concluded this on their website, what he just said, in which it was reported on the British Medical Journal website that they recommend that not to recommend gluten-free diets because it increases the risk of heart disease, of cardiac problems, okay? Now, first point is that's not what they said in the conclusion of this research paper. The people who did the research paper, that wasn't their conclusion. That was the conclusion of the British Medical Journal in editorializing it. Problem is, that's what ended up on the news. That's what I heard. It was on multiple channels. It was on NBC, ABC, CBS. It was on MSNBC. It was on CNN that I know of. Okay, but that's what got out there. So our concern is that if you're out there and you're paying attention to the news, you've heard, oh my God, if I'm on a gluten-free diet, that's going to increase my risk of heart disease. Can you do this in like 3 minutes? And tell them why that's not particularly true. And that's not even what the summation said in the actual research paper itself.
Mm-hmm.
So
keep talking for a little bit longer.
Keep talking for a little bit longer.
So find the one specific.
So these are the things that I listen every morning for these things. That's my job. I listen to Dr. Sanjay Gupta, for example. He has something on at 6:45 every morning on a radio station that I listen to. And I would say that at least 2/3 of the things that he puts on there, I have to roll my eyes, because they are items that if you hear these items, they're going to contradict what we've told you. Because not unlike this goes even further, this cardiac thing. Not unlike this, Dr. Gupta, first of all, he doesn't practice. I forget if he's a neurosurgeon or a cardiologist.
He says he practices.
He's a neurosurgeon.
At least one day a week.
Who doesn't really practice, okay? But he has no concept of what's causing the problems in the brain that he has to work with if he does practice. So he has made his name doing research papers. This is a big thing for you to understand, because the thing today for a lot of these people online on television is to put out research papers. And then the research paper doesn't really evaluate for many different variables. It doesn't evaluate for the variables of stress, how long you've had your problem. It just usually takes one isolated item out of there. Now, you realize from going through this that everything is connected, okay, from going through your program. Now, this research paper is a research paper that indicates that the probability of you having a cardiac arrest, a cardiac problem from going gluten-free is almost infinitesimal. And their summation even indicates that it's not really a big problem. And that they're not making these definitive recommendations of getting off of gluten or not getting off of gluten and so on and so forth. But the British Medical Journal, which has a very interesting position, and it's a political position, takes this and then twists it to say that doctors should not recommend gluten-free diets to people who do not have celiac. This is the way that you're getting your information, and this just isn't happening in the gluten-free diet world. It's happening in many different worlds, in parts of the healthcare world where you need to be educated on certain things, or you're being educated on certain things, would be a better way of putting it, in which you're getting incorrect information based on our clinical observations and based on our clinical expertise that might shake your confidence on continuing with your program. Now what do I do? I'm not getting enough grains, and so on and so forth. So, we have never done a, I don't think we've ever done a hangout on studies and being careful of the research. And if you have research that tells you not to take this vitamin, or there's no such thing as leaky gut, or there's no such thing as gluten sensitivity, there's no such thing as non-celiac gluten sensitivity, or gluten is bad for you if you're not celiac, or any of those things that contradict what we've told you, you need to come to us. You need to come to us and ask us about these things, because I watch for these. Dr. Gates does continual research on trying to fine-tune your programs. I watch for this type of stuff every day. Every day I go through everything to look and see what's going to sabotage our people. So really, that could be the hangout. I mean, that could be the thing if you want it.
I mean, really, I think this statistic will help to bring it home. So what they did is, there's this thing called the Nurses' Health Study, and they look at nurses, and they collected a lot of data on these individuals from 1986 to about 2012. And they had them keep food questionnaires, and they were tracking their health status, their blood pressure, all these different variables. So out of this study, they looked at their diets, and they wanted to examine this association with heart disease, like you were saying. Now, what they found was that, here are the exact statistics. Compared with participants in the lowest fifth of gluten intake. Now I'm going to pause right there. They didn't actually make sure that people were gluten-free. In the study, they didn't even ensure that they did have or did not have celiac disease. They asked the questionnaire, do you have celiac disease, yes or no? But there was no definitive test saying, oh, well, this person did have celiac disease, and that's why they're on a gluten-free diet. Important point, because celiac disease patients have been found to have heart disease because of the inflammation from the gluten response.
From the gluten, exactly.
So they're just saying, okay, those who basically consumed the lowest fifth of gluten. Okay, so that's where we're at. Who had a coronary heart disease incidence rate of 352 per 100,000 person years. Let me say that again. 352 cardiac events per 100,000 person years. So when Dr. Rutherford is saying infinitesimal, you'll see what we're saying. Those in the highest fifth had a rate, so these are the people who are consuming gluten all the time, 277 events per 100,000. So we compare 352 versus 277. And from that, the researchers conclude, well, there is a difference in 75 cardiac events per 100,000 person years. And I hope that you can understand that that is almost laughable. But from a statistical standpoint, see, this is what statistics comes down to. If you want to be a liar, become a statistician. One of my teachers once told me that. I'm not saying these authors are liars, but what we are saying is that you need to be able to interpret the research. And you are being pounded right now from all these mainstream media outlets that now it's been confirmed there's this association between a gluten-free diet and increased risk of heart disease, and oh my gosh. And when you actually look at it, it's a difference in 75 cardiac events per 100,000 person years. That's pretty amazing. And then they go on to say, however, after adjustment for race, body mass index, height, diabetes, regular aspirin or non-steroidal anti-inflammatory drug use, statin use, multivitamin use, alcohol, smoking, parental history of coronary heart disease, hypertension, high cholesterol, hypercholesterolemia, physical activity, menopause status, and menopausal hormone use, the association was no longer significant.
In other words,
but you don't hear that in the media.
Right. In other words, all those things could have caused those 75 people to be the ones that were more susceptible. But it comes out in the British Medical Journal as a recommendation to their physicians: do not recommend gluten-free diets. Now, here's all you need to know about gluten-free diets, people. If you don't eat gluten and you feel better, don't eat gluten.
Well, that's something that's not being emphasized enough. So it's irking some people who may have power in our society relative to the food supply, that at least I think it was in 2014 is a statistic I remember, upwards of 100 million people went on it or were trying a gluten-free diet. The reason why is that when a lot of people go gluten-free, they may have an improvement in abdominal symptoms. That's been acknowledged. That's acknowledged in this research article, though it's been contested in other ones. A lot of people, when they go gluten-free, they have better energy, they think better, they have less headaches, maybe their balance is better if they have balance issues or they have peripheral neuropathy. We've talked about these associations at length to the thyroid, but now they have a study saying, oh, we found an infinitesimal difference between, you know, one group who's consuming, really it's just a low amount of gluten versus those consuming a high amount of gluten. And really their main point is that, well, it's probably from not consuming grains that have lots of fiber, which is something that when you look at a lot of practitioners who are putting people on gluten-free diets, we're recommending people to mainly eat a vegetable-based diet. We're not saying to just be consuming gluten-free bread 5 times a day. We're saying consume these fiber-rich foods, which will help with this.
Another factor which they did not control for.
Which is not controlled for, which is not.
So it's a terrible study. It doesn't even really say that it's a big deal. And then the British Medical Journal comes out and says, essentially, it is a big deal. And then it's picked up by all the media. So don't be confused by this. Just, if you're doing well in your program, and the vast majority of you are, keep doing what we told you to do. Okay, stay away from the gluten from now until forever. And if you believe the British Medical Journal, go party out on gluten for about 3 days. And don't call Dr. Gates after you're sick. Just, just know that it'll be okay when you stop again for about 4 months more. So, okay.
Okay. Thanks for watching.
All righty. See you next time.